Good day. My name is Kit Marcel P. Batingana and I am your student nurse for today. Now I will be performing wound care. First thing we need to do is to identify our patient using at least two identifiers. This is in order for us to know that we have the correct patient. So sir, ano sa full name na to sir?
Chrysler J.B. Cambio.
Birthday sir?
June 3, 1999.
Okay sir. The next thing we need to do is to review order for irrigation and type of solution to be used. So, Mr. J. Candia, according to the doctor's order, is to use normal saline as upon wound care. Next is to assess patient's level of comfort, offers analgesic at least 30 minutes before removal. So, sir, kumusta mo itong feeling karon sir? Kailan ta sir?
Okay lang man, medyo init lang.
Unit. Okay, sir. And next is to review medical record for symptoms and related to patient's open wound. So, according to medical record, na patient has open wound due to injury, motorcycle injury. The next is to assess patient for history of allergies to antiseptics, medication, tapes, or dressing material. We need to do this in order for us to know if our patient have any allergies on such things or in our materials to be used for the safety of our patient. So, sir, about tayo mga allergies, sir, such as kana sa mga latex, sa mga saging?
Wala man po.
Wala siya. Okay, sir. Then the next thing we need to do is the planning phase. Next, identifies expected outcomes. The next is the planning phase. Then the first thing we need to do is to identify expected outcomes. This is done in order for us to know what will be our expectation before and after the procedure. The next is to administer analgesics 30 to 45 minutes procedure if needed. I repeat, only if needed. If our patient is having some pain, then we need to administer some analgesics. The next is to educate patient and family about the procedure. We need to educate our patient or the guardian or family in order for our patient to participate and cooperate throughout the entire procedure. Then next, okay. So, sir, karon sir, kay ang order sa doctor sir is mag-change og dressing sa mga wound sir kay para pag kay hugo na magud siya sir, need na to sa tanggal ng ilis na to bago para mas mag-process ang healing sir. Mga siya sir. Okay na sir.
Okay lang.
Then, next thing we need to do is to gather the appropriate supplies. We need to gather the appropriate supply to save time and energy. So, we have here the kidney basin, the biohazard trash bag, our gauze bandage for the changing of dressing, our tapes, cotton buds for the acquiring of specimen culture, then some pen for the recordings, the bandage scissor for scissor cutting. Then we have our syringe with the imaginary catheter. Okay, catheter. Then we also have our waterproof blanket. This is important so that all the fluids or liquids will be absorbed in here later during our procedure. Our alcohol for the hand hygiene, normal saline as the doctor's order. Then we also have our PPEs in here, the face shield, mask, apron, and our gloves. So, next is to provide privacy, perform hand hygiene, and position patient appropriately. This is done in order for our patient to be comfortable throughout the procedure, and hand hygiene to deter the spread of microorganisms, and position patient appropriately for the comfortableness of our patient. So, close the door. Then, next is the implementation phase. First thing we need to do is to perform hand hygiene. Once again, to deter the spread of microorganisms, and to be clean. Next is Form cuff on a waterproof biohazard bag and place near the patient. Form a cuff biohazard bag. You need to form a cuff in order for that our trashes will be easily inserted our bag. Okay. Here. The next, applies PPE, uses sterile precaution if needed, discard all dressing and gloves, perform hand hygiene. So our PPE, mask, or apron, face shield, and our gloves. We need to apply PPE for the safety of our patient to deter the spread of any microorganisms. The next is to perform hand washing. We will perform hand washing in order to deter the spread of microorganisms while performing the washing of the wound of our patient entered. The next is to wash the wound of our patient with a water or the shower water while our patient is sitting. We need our patient to be seated to resume the safety of our patient. So first thing we need to do is to turn on the shower. Sir, check kung tubig, sir. Okay naman siya, sir.
Okay lang.
Okay na siya. Okay. The next is to wash with direct pressure. Okay. Then the appropriate amount of wash to clean. We need to shower this in order to really clean the wound of our patient. Wait.
Gloves pre.
Then here we are, after showering the wound of our patient for 5 to 10 minutes, the next thing we need to do is to obtain culture after cleansing with non-bacteriostatic saline when indicated. We need to obtain the culture because this will be sent to the laboratory to know if there are any other microorganisms or if the exudates or the culture has shown progressive of healing. So sir, mag-obtain tag culture sa mga samad sir ha para makabalog ito sir if mga to ang wound is kaning nagalala ba siya or nabay progress ng atong healing sir. Okay. Kuha na ko sir. Then you need to put in the clean container, then set it aside, then it will be sent to the laboratory later. The next is to dry wound edges with gauze dry patient. Need to dry na to sir. Then apply appropriate dressing labels with time, date, and student nurse initials. You need to baba. You need to label the time and date of the dressing of our patient in order for the next on-duty nurse or the next doctor will know when the dressing has been changed or when will be next changed and when will be it next to be changed. we need to secure it so that it will not fall off. And then label with time, date, and the nurse's initials. Then after is to remove mask, goggles, and gown. Mask, then gown. Then dispose the equipment and sold supplies, remove gloves, and performs hand hygiene. There. Perform hand hygiene. Once again, to deter the spread of microorganisms. Then, for the evaluation, have patient rate level of comfort. In this, we will know if our dressing was a success or not, or if there are any irritations or discomfort that our patient has been feeling. So, sir, kaning okay lang ato ang dressing, sir. Wala ba tayo kaning reklamo, sir?
Ito naman.
Kanang wala ba yung say katul ba or ano?
Smooth man po na pag-dress.
Okay. Okay, next is to monitor type of tissue in wound bed. Monitor the type of tissue in wound bed in order for us to know if the wound of our patient is healing progressively. The next is to inspect dressing once every shift or as ordered. In order for us to know if our dressing was a success or if it needs to be changed. The next is to evaluate peri-wound skin integrity. We need to evaluate the peri-skin wound integrity of our patient, again, in order for us to know if there are any complications or any progressive of healing has been occurring. The next is to observe for presence of retained irrigant. We need to observe the presence of retained irrigants in order for us to know if the wound site of our patient is clean or not. Then, recording and reporting. Record procedure performed and find all findings in the patient's chart in order for us to document and track of records of when will be it next to be changed. And sign. The next is to report to healthcare provider any evidence of fresh bleeding, sharp increase in pain, retention or irrigant, or signs of shock immediately in order for our physician to be aware of this all. And throw these in the trash bag. And that will be all. Thank you.